Today's video, we have Dr. Gladys Fernandez, the Education Director for the Simulation Center at Bay State Medical Center, here to help us safely don and doff a PAPR. Before Dr. Fernandez is ready to don the PAPR, she needs to ensure that she has all of the supplies that she needs. So she needs hand hygiene product. She needs something to clean it with. So that can be either a Super Sani cloth or Virex 256. Please note that the Super Sani cloths have a 2-minute contact time, whereas the Virex 256 has a 10-minute contact time. And what that means is that is the amount of time that the product needs to remain wet on your PAPR hood in order to be effective. She also needs a PAPR hood, a PAPR blower/battery mechanism, which is the heavy pack that she's holding there, and the tubing that connects the battery pack to the PAPR hood. She also needs a pair of gloves in her size and a disposable gown. So to start, she's going to clean her hands. When she's done cleaning her hands, she'll don a pair of gloves in order to sanitize the mechanism prior to using it. Dr. Fernandez is going to demonstrate using Super Sani cloths. If you're going to use Virex 256, you'll also need a blue microfiber cloth. These are available on most of the units, and when you're finished with a blue microfiber cloth, please dispose of it within the patient laundry. Start by taking a Super Sani cloth and cleaning the inside of the PAPR hood. Then clean the outside of the PAPR hood. Next, she'll clean the battery pack and hosing mechanism. Now that the PAPR is clean and ready for use, and 2-minute contact time has elapsed, before donning it, you have the option to wipe it out on the inside with a moist paper towel if you have experienced irritation of your eyes or your nose due to the residual chemical from Super Sani cloths. Dr. Fernandez is now ready to don the PAPR. So the first step is to don the hood. It's easiest if you grasp it and place it under your chin first and then roll it onto the top of your head. Ensure there is a good seal around your chin and your face. Next, don the belt. Make sure that the blower and battery pack unit is seated at the small of your back. Attach the hose to the hood. Should hear it click. Turn it on. You should hear air blowing around your ears. Next, don a gown. Be sure not to break the neck hole of the gown, placing it over the PAPR. Next, Dr. Fernandez will remove her gloves and perform hand hygiene prior to placing a new pair of gloves on. Make sure that your gown is fitted so that if there are thumb holes, your thumbs are through thumb holes. The air entry to the blower is right below the 3M symbol. Ensure that your tie is below this, not obscuring the air entry point. Dr. Fernandez is ready to take care of patients. Dr. Fernandez is finished taking care of patients. She's going to doff her PPE safely. First, by pulling the gown to release the ties and rolling the sleeves off of her arms and removing the gloves in one block. She then performs hand hygiene. And exits the room and prepares to doff her PAPR. She starts by cleaning her hands if she touched the door or any other patient care equipment prior to leaving the room. Next, she'll don a pair of gloves and get ready to clean the PAPR for the next user. Again, Dr. Fernandez is going to demonstrate using Super Sani cloths. To sanitize the PAPR for the next user, first start by cleaning the outside of the PAPR. Doff the PAPR hood and sanitize the hose. Note that the belt and the blower, as well as the hose, has been inside your gown and is protected. This is a sanitizing step. Lastly, clean the inside of the PAPR. Perform hand hygiene. When you've completed the cleaning of your PAPR and removed it to storage, please clean the table that you used to clean your device. Dr. Fernandez is going to demonstrate cleaning the table with Virex 2256. Using the squirt top bottle prevents aerosolization of the product and is the preferred method. Saturate the cloth and wipe down the table. Ensure that the table remains damp with the Virex 2256 for 10 minutes. Discard the microfiber cloth into the dirty laundry.